Diabetes, the complete guide. What is diabetes? Diabetes is a metabolic disease characterized by a high concentration of sugar, glucose, in the blood. In Latin, the name of the disease is diabetes mellitus and its meaning, sweet urine. The source of the name, when blood sugar rises above a certain threshold, 180 mg per deciliter, it increases its absorption capacity in the kidneys, resulting in the secretion of sugar to the urine, a condition called glycosuria. The main problem with diabetes is the relative or total lack of the insulin hormone. Insulin is produced in the pancreas and is secreted to the blood in response to an increase in sugar levels, e.g. after meals. Insulin allows the sugar to flow from the blood to the body's various cells, where sugar is needed to produce the energy necessary for normal functioning. In diabetics, there is a lack of insulin or a defect in its activity or a high resistance of tissues to it. If you suffer from a lack of insulin or improper insulin, your body does not have the means to introduce sugar into the cells. As a result, blood glucose accumulates, a condition called hyperglycemia. In a situation called insulin resistance, the picture is different. The amount of insulin excreted from the pancreas cells can be normal and even increased, and insulin may be perfectly normal, but its activity in the target organs, such as muscle or liver, is poor. Insulin resistance usually begins about a decade before the diagnosis of diabetes. The normal levels of sugar in those 10 years are due to an increased insulin secretion. Types of diabetes. There are 4 main types of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes, and diabetes for other reasons such as a hereditary defect in the production of insulin, MODY, diabetes following steroid and diabetes following organ transplantation. Type 1 diabetes, also known as juvenile diabetes, results from a complete lack of insulin resulting from the destruction of cells in the pancreas that are responsible for the secretion of insulin. It is one of the most common chronic diseases of childhood. 2/3 of new cases of type 1 diabetes are diagnosed by age 19. However, the onset of the disease at an older age is not uncommon. Up to 25% of new cases of type 1 diabetes are diagnosed in older adults. Type 2 diabetes is also called insulin-dependent diabetes because it breaks out while the pancreas still produces insulin, but insulin cannot do its job to inject glucose into the body's cells. It can occur at any age but usually occurs after age 40. It is mainly due to genetic predisposition but is also strongly influenced by lifestyle. In the past decade, there has been a steady rise in the development of type 2 diabetes among adolescents, mainly because of the obesity epidemic. The genetic predisposition to type 2 diabetes can be affected by maintaining a normal weight, avoiding smoking and keeping regular exercise. These 2 factors, normal weight and regular exercise, can delay the onset of diabetes for many years or even prevent it altogether. What are the symptoms of diabetes? Diabetes is usually found in random blood tests and has no clinical symptoms. When blood sugar levels are very high, more than 250 mg per deciliter, symptoms may appear characteristic of the disease. Multiple urination. When blood sugar rises, the blood absorbs more fluids, resulting in increased fluid flow through the urine. Severe thirst and dry mouth. These feelings result from the loss of fluid that is the result of urination. Weakness, fatigue, and hunger. The reason for these feelings is the ability to use sugar to create energy. Weight loss. Sometimes there is a weight loss despite adequate food intake. The reason for weight loss is that the body utilizes its fat layers instead of the sugars it cannot utilize. Disturbances in the limbs such as tingling, burning sensation, the feeling of heat or cold and even loss of sensation. These sensory disturbances are caused by the damage caused by high levels of sugar in the nervous system. How is it diagnosed? The diagnosis is made using a blood test. There are several measures by which they can be diagnosed with diabetes. Blood glucose level after fasting is 126 mg per deciliter or more in 2 separate tests. The blood glucose level is 200 mg per deciliter or more than 2 hours after loading 75 grams of glucose through the mouth. A glucose level of 200 mg per deciliter or more in a randomized test. In this case, however, a repeat examination is required, especially if the first test is performed in a state of stress, for example in hospitalization. There are 2 intermediate states called prediabetes, in which glucose levels range from normal values to actual diabetes values. Impaired fasting glucose (IFG), a blood glucose level that ranges from 100 to 125 mg per deciliter after fasting. Impaired glucose tolerance (IGT), glucose level between 140 and 199 mg per deciliter for 2 hours after loading 75 grams glucose through the mouth. How to treat? How to treat? The key in the treatment of diabetes is prevention. If you adopt a healthy lifestyle, abstinence from smoking, maintaining a healthy body weight and a healthy diet, regular exercise, you can prevent diabetes or at least postpone it for many years. Critical importance is to prevent the so-called pre-diabetes from becoming diabetes by changing lifestyle. This is actually the last window of opportunity to prevent diabetes just before it breaks out. After the disease breaks out, it is almost impossible to turn back. The clock. Treatment is different in each type of diabetes. Type 1 diabetes does not have any beta cells, so treatment is entirely based on insulin delivery from the outside. In contrast, type 2 diabetes has beta cells that are still functioning, so treatment can be based on this residual function. However, diabetes destroys more and more beta cells over time, so even type 2 diabetics often come in to need insulin therapy. The first rule for treating diabetes, especially those with type 2 diabetes, is a change in diet habits, appropriate physical activity, and weight loss, if necessary. Various studies have repeatedly shown that even a modest reduction in weight combined with moderate physical activity has dramatic results in controlling diabetes. In addition to lifestyle changes, diabetics also need medication. There is no real difference between the recommended diet for diabetics and the recommended diet for healthy people. For both of these, it is recommended to consume a variety of foods from all the food groups and in quantities needed to maintain a normal weight. However, people with diabetes should be very careful about the amount of carbohydrates and the type of carbohydrates they consume. They should avoid high glycemic index sugars, which cause a steep increase in blood sugar levels, such as sweets, white bread, sweet drinks, etc., and consume complex carbohydrates with low glycemic index, whole grain bread, grits, sweet potatoes. In addition, it is very important that they divide their food with 6 meals a day, 3 main meals and 3 snacks. This division is essential to prevent large blood sugar fluctuations. These things suggest that diabetics are advised not to skip meals. People with type 1 diabetes, treatment is based on the administration of insulin. There are several types of insulin, and they are classified according to their duration. What are the warning signs that require immediate treatment? As a result of medication, hypoglycemia may cause hypoglycemia. The signs are rapid pulse, weakness, tremor and even vagueness and loss of consciousness. The immediate treatment is the rapid consumption of glucose in food or drink and in the extreme case, glucagon injection. Even too high levels of blood sugar can cause blurring and loss of consciousness and require immediate medical assistance. How to live with diabetes? It is important to have a routine that includes strict medical care and routine tests, such as periodic blood tests, an eye exam once a year, daily self-examination, periodic follow-up tests, and vaccination against pneumonia and flu vaccination. The purpose of this routine is to enable the continuation of a healthy and quality life for many years. Thank you for watching. If you liked this video, please share, give us thumbs up and subscribe to our channel.